Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Modifier 24. Now, if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button, and at the end of this video helps you, I hope that you will share it. So let's get started. All right. Now, before we begin, I'm going to include the link for the two previous episodes that I've done for Modifier 57 and the one for the Global Surgical Package Explained, okay? Because if you haven't watched these two videos, this video is probably not going to make a lot of sense to you, okay? So if you would, watch those two first and then watch this one, okay? Now, let's get started. I'm going to be citing from two separate websites, the Novitas website and from physicianspractice.com. I really like both of these articles because I think that they talk about Modifier 24 appropriately. And I'll be leaving them down in the description box below, so please read them when you have a chance. Now, according to physicianspractice.com, there was an article written by Betsy Nicoletti, and I really like how she breaks it down. So she says, Modifier 24 is appended to an evaluation and management service, never to a procedure, okay? To indicate that an unrelated evaluation and management service was performed by the same physician during the postoperative period. Note, other same specialty physicians are included in the definition of same physician. That is, if a surgeon is covering postoperative patients for her partner, the covering surgeon is considered to be the same physician and does not bill for it, okay? Same thing like with PAs, all right? Sometimes they'll start out with the surgeon and then they'll do the follow-up with the PAs, okay? Remember, Modifier 24 is used for an unrelated evaluation and management service. Now, I really like these three examples that she uses. So there are three examples when you could use Modifier 24, okay? The first example that she says, a surgeon performs a hernia repair on May the 20th. The procedure has a 90-day global period, of course. Also, all related postoperative care is included in the payment for the hernia. But on July 1st, still within 90 days, okay, the patient returns to have a breast lump evaluated. Report the evaluation and management service with Modifier 24 attached and use the new diagnosis breast lump as the reason for the visit. Okay? Clear as mud, right? The next one, which is of course my favorite one because it's an orthopedic example. And of course, as you know, I am an orthopedics and podiatry nerd. Those are my two favoriteest specialties. So anyway, an orthopedist treats a fracture on December 15th. And the patient returns with shoulder pain on January the 10th. The January 10th visit is separately reportable with Modifier 24. Okay? Because that has nothing, the shoulder has nothing to do with the hip. Just saying, okay? And then the last example that she gives is a surgeon who is managing immunosuppressive therapy during the postoperative period for a transplant may also use Modifier 24 for the E&M services and be paid separately for these. Because if you recall from the last video where I talked about the global surgical package, immunosuppressive therapy is not included in the post-surgical payment. Okay, so now on to the Novitas website. So Modifier is, I like Novitas. Novitas is a wealth of information. It's got information about evaluation and management and modifiers. So this is a very valuable website for medical coders, I'm just saying. It says Modifier 24 is defined as an unrelated evaluation and management service by the same physician or other qualified healthcare professional during the postoperative period. So like I said, nurse practitioners and PAs, that kind of thing, they all fall. Okay. And then it's, let's see. Medicare defines the same physician as physicians in the same group practice who are of the same specialty. Okay, just like I said. In this instance, they must bill and be paid as though they were a single physician. All right. So Modifier 24 is applied to two code sets, E&M and general ophthalmological services, which are eye examination codes. And the appropriate use Modifier 24 on appropriate level of evaluation and management service. Use modifier 24 on an E&M when an unrelated E&M service is being performed beginning the day after the procedure, okay, by the same physician during the 10 or 90-day post-operative period. Because remember, there are minor procedures that have a 10-day global period, okay? So this applies to that too, okay? So anything that you would be treating within that period of time that is separate from the procedure, you would append that modifier 24, okay, to the appropriate level E&M. Documentation indicates the service was exclusively for treatment of the underlying condition and not for post-operative care, okay? The same physician is managing immunosuppressive therapy, again, we just talked about that, during the post-operative period of a transplant, okay? So even though it is for a transplant, that immunosuppressive therapy is completely separate, okay? The same physician is managing chemotherapy during the post-operative period of a procedure, okay? Again, separate. And then unrelated critical care that is performed by the same physician during the post-operative period. And the same diagnosis as the original procedure could be used if the new E&M is for a problem that occurs at a different anatomical site. So it's going to blow your mind, right? But yes, so just keep that in mind. Inappropriate use. Do not use modifier 24 when the E&M for the surgical complication, when the E&M is for a surgical complication or infection. This treatment is part of the surgical package. Again, we talked about that in the global surgical package explained video. The service is for the removal of sutures or other wound treatment. This treatment is part of the surgery package. Also inappropriate would be the surgeon admits a patient to a skilled nursing facility for a condition that is related to the surgery, okay? Also not separate, okay? And then outside of the global period of a procedure, okay? This modifier 24 stops the second that end of that global period, it stops. You don't have to think about that modifier 24 unless the patient is back in a surgical global period again, okay? So anytime after they're out of that 90-day global period, because remember, it in total, it is 92 days. The day before, the day of the procedure, and then 90 days afterward, okay? So keep it in mind. And then services also inappropriate would be services that are rendered on the same day of the procedure. Reporting exams performed for routine postoperative care, reporting surgical procedures, labs, x-rays, or supplies is also inappropriate, okay, to use the modifier 24. Now, they have a good little map that asks you questions about yes or no, and then it'll tell you if modifier 24 is appropriate or not. It's really a good little graph that you have here. So be sure to check out this link for the Navitas website. And like I said, I'll be leaving them both down in the description box below. I know that these modifiers are really something else and they do get confusing. I totally get it. Make sure if you are using your CPT Professional Edition that you are looking in the appendix, because the appendix will give you a whole list. And I believe it's Appendix A. It will give you a whole list of all the modifiers and it will describe in detail why you should apply that particular modifier or whatever the case may be. If you are stuck, if you don't really know if it's appropriate or how to, always do your research. Do a Google search, do some other internet search, okay? And just type in what is, whatever modifier you're trying to look up, or when is it appropriate to apply, and look at wherever you're looking to make sure that it is a legitimate resource and that it's not just a he said, she said type website, okay? You want something like Navitas or something like that that's going to give you the answer appropriately, okay? Navitas is very comprehensive. They've got lots of really good information. They've even got a global surgery calculator on here as well. global surgery and related services. There's lots of different references that are available on this website. And again, I keep telling you guys about the CMS website because CMS is really very good at explaining things. And please look at that booklet from the Medicare Learning Network that I had put on the Global Surgery Explained video, okay? Because it has a lot of really good information. But yes, that is when you would report Modifier 24, when it is a completely separately identifiable service, not having anything to do with whatever they had the surgery for, but this evaluation and management is occurring during the postoperative period, okay? So that's when you would report that, because sometimes these things do happen. Like in the example of, having the hip surgery, right? And then the patient coming back for a shoulder. I've seen many instances where they have different things that the patient is coming in for. So those are the things that you really have to look at and make sure that you understand when you're reading what is happening, okay? And if you're having a hard time really sort of figuring it out, this is when you need to work with your provider. Your provider should be documenting that this patient had a surgery on this date. They had this surgery, the name of the surgery, right? And then they had it on whatever particular date. This way, if you have this information in the note, you're not having to sit here and second guess and wonder and have to query because you don't know if this patient is still in the postoperative period. This information is crucial because this is going to let you know if there's something else going on or if they have to work up an additional condition for whatever reason, then you'll know if they are in the global period or not. I have seen this many, many times. And I even had a provider who wrote very little documentation, right? But it was enough to get an evaluation in management level. And he was saying that he was ordering additional workup for a condition that was unrelated to the surgery. And so I was telling him, I said, sir, you did really great. When I saw him later, I said, you did really great. I saw a documentation and I gave him the example. And he's like, oh yeah, I didn't think that I was going to get any credit for that. Yes, you can. He goes, but the patient was in the postoperative period. I said, I understand. But they were in the postoperative period for a separate condition, okay? This is a completely different condition that you're working this patient up for. So he's like, oh, wow, I didn't know that. And see, that's the thing. When you're a coder and you go above and beyond to understand these things, to understand the global package, the global surgery, what does it mean, and all the modifiers and everything else, when you go above and beyond to understand these things, your providers are going to trust you more. They're going to trust you because they know that you're looking out for them and that you're keeping their best interests in mind, okay? As long as, and I tell my providers, as long as the documentation is there, that's all I need, okay? If I need something clarified, I'll let you know. But if you give me the documentation, tell me what's going on. That's the thing I tell them too. You got to tell me what's going on. I am not in the room with you. Would I love to be in the room just to be a fly on the wall to listen in and see what's going on? Sure. But it's just a situation the way it is. I only know what's going on by what you're documenting. You have to document everything. Well, Blue, I'm not going to get paid. Don't worry about the fact that you're not going to get paid because you really don't know. In the instance of that one provider who said, well, I'm not going to get paid for it anyway, he actually did because he had enough documentation there for this separate condition in order to get the evaluation and management with a 24 modifier on it. And so then he was like, oh, okay. So then he knew I had his back. So he's like, wow. So then I heard him later he's like, guys, did you guys know that? And they were like, yeah, she says this all the time. And I don't know, maybe he just wasn't around because he had been in and out a lot of the facility a lot. So maybe that he may have missed one of my classes. But I tell them all the time, you got to let me know things in detail. And it's not going to be a guessing game. And if it's not documented, it did not happen. That is our number one motto as coders. If it's not documented, it did not happen. Okay. So if you don't tell me what's going on, I won't know. Okay. And the only way you're going to know is when you start talking to your providers. Okay, so make sure you're talking to them, make sure you're reviewing. I know things are kind of hard right now with COVID and everything, and we're still on the lockdown with being at home and stuff. I call it lockdown because we're still at the house. I don't know, guys. Anyway, so in closing, please make sure that you're looking over Appendix A. It is Appendix A of the CPT Professional Edition, okay, by the AMA. Because I know there's many different versions out there. And I know I'm always harping about the Optum 360 versions. But in this instance, I like the Professional Edition by the AMA, okay? The Optum 360 CPT book is really good for other information, but a lot of that information is not really what I need at that moment. So if you really look at the appendixes, again, I'm going to be harping on those appendixes because people tend to overlook those. I know that I was once guilty of overlooking them myself. But now that I know this, and I'm sharing it with all of you, so hopefully you will learn from my mistakes. You will learn that from these tips that I'm telling you guys, because, you know, somebody's got to point it out. At least I pointed it out, right? Anyway, I'm going to wrap this one up. So I hope you've enjoyed this one. Tomorrow will be an episode about professional dress, which is going to be completely different from what we've been working on, which lately is a lot of technical stuff, okay? So I hope you'll join me for that. And I will see y'all on the next video. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!